These and more people are some of the patients that await health services at the Kisenyi Health Center in Kampala that has been designated to handle typhoid cases since the outbreak a week ago. The number has since risen from 35 to over 600. These are kept here under surveillance and getting treatment for the waterborne disease that the ministry warns may spread further. The latest typhoid outbreak in Kampala is attributed to the heavily contaminated water and other beverages being consumed by people. Assistant Commissioner in charge of epidemiology and epidemic diseases at the Ministry of Health, Dr. Monica Musenero, attributes the surging outbreak to the contamination of the existing environment, especially water, sewer systems, and the laxity in household hygiene and sanitation.
Most of the water, apart from the packaged water, the mineral water, the rest of the water being consumed, the juices, they are all heavily contaminated with the feces. All the sources of water, in fact, we tested juices, we tested bushera, we have tested the water, this water which is packed in Bovera. All of it is heavily contaminated.
The outbreak indicates after laboratory tests that there was increase in contamination of water, which led to 639 cases registered by Tuesday at Kisenyi Health Center 4, just a week after the outbreak was reported. Dr. Musenero, however, confirmed that the ministry is currently at the front line of the outbreak by managing the cases through the supply of drugs, providing technical support to Kampala Capital City Authority, and identifying the gaps like health personnel, as well as understanding the disease.
We have supplied all the drugs that are needed. The first batch and the second batch is being supplied today. We have also provided technical support, actually the individuals who are there out helping KCCA on a daily basis to make sure that everything at the health center is moving. We are identifying gaps because the numbers are more than we had initially expected.
Household health will make the difference in such a contaminated environment by keeping to proper hand washing 5 times in flowing water, excluding the mealtime and after the toilet washing, boiling of drinking water properly, leaving it for at least 2 minutes boiling, and households acquiring water disinfectants. Dr. Richard Wariomu, the Central Division Medical Officer, says the disease has become a threat because it depicted symptoms like fever, abdominal pain, vomiting, and headache that are similar to malaria and could be misunderstood.
As we roll over during the weeks, we are realizing that we are seeing about 110 patients every day. As I talk now, the cumulative figure is about 500, with no death yet, except some 5 people who had died initially before we started treating.
Kasese district had the worst typhoid outbreak in the country in 2010-2011 that took 2 years to contain. When not treated in time, typhoid can lead to perforations in the intestines. East Africa is developing a new vaccine for typhoid that has already been tested in Kenya and Burundi and will now expand to Uganda.